All right, so the nervous system receives sensation from stimuli, and that's input. This response can be voluntary or involuntary, and that would be output. And then all this processing has to go on in between to connect our outputs, our motor responses, with our inputs, our sensations. And if you take the time to think about it, that makes perfectly good sense. So let's talk about some inputs. Some inputs would be like vision, what you see, hearing, touch, smell, and taste. Those are very simple senses that we all learned about in kindergarten class. But some other senses you should be aware of is something called proprioception. This is your perception of your body's position. If you stand up and close your eyes and strike some nice pose, you can feel the position that all your body parts are in because of a sensation called proprioception. The vestibular system is head acceleration, and if you want to feel your vestibular system at work, just sit in a chair and spin around in circles a few times, and when you get still, you can still feel the world moving around about you. Your ability to feel your head moving through space is your vestibular system. And then some other internal senses, you can sense organs as well. I just wanted you to know that your body's senses are a little bit more complex than just vision, hearing, touch, smell, and taste, the stuff they taught you in kindergarten. These organ senses, notice when you're panic, when you're having an adrenaline rush, you can really feel it. And that's an important sensation as well. Well, after we've received these senses, processing must occur with these senses. Perception, how do we perceive the world around us? How do we interpret the world around us? That's perception. Memory, hopefully you guys know what memory is by now. Emotion, there's certainly plenty of that. I wouldn't have to explain that. And thought, we could certainly use a lot more of that as well. And then there's some unconscious processing that goes on. Sure, some of our memories and thoughts and emotions and perceptions are unconscious as well, but we also have reflexes that are built inside of us that are hardwired that we can't stop. And so these are different words that you're already familiar with that I just call processing. And then if you think about it, what kind of output do we have as human beings? Very little. When you think about our outputs, you realize our outputs are quite simply motor movements. Now we have this thing called speech, which is really a great thing, at least for most of us. But if you notice, speech is just quite simply a collection of orchestrated motor movements. And so our outputs from a neurologic point of view pertain to movement. You might hear that called locomotion. And I'll tell you right now, this voluntary control of skeletal muscle, the neurologic system that does that, we call that the pyramidal system. And the reason we talk about the pyramidal system is here pretty soon we're going to be talking about the extrapyramidal system, and so it might be nice to know what the pyramidal system is. And then there's involuntary outputs as well, stuff you really don't control. Your autonomic stuff, like the things listed here, you don't have a lot of control over them if you think about it. But these are other forms of output as well. So the reason I divide the nervous system is input, processing, and output, so you can take away this little lesson right here. We hear about patients who are paralyzed for surgery but not anesthetized, and so even though they're paralyzed, they're awake and alert for surgery. We use paralyzing drugs like acetylcholine or vecuronium. They cause paralysis at the neuromuscular junction, and so since they're paralyzed, their face will be paralyzed, their body will be paralyzed. their respiratory muscles will be paralyzed. That'll make it easier to do surgery. More relaxed muscles make it easier to do surgery. It's easier for the breathing machine to ventilate the patient when they're paralyzed. But the problem is that we have to use other drugs to anesthetize them, not just paralytic drugs. So when the patients receive these paralytic drugs, sometimes they're confused for being asleep, and that's not the case at all. Paralytic drugs only affect movement. Paralytic drugs do not reduce pain. Paralytic drugs do not reduce sensation. Paralytic drugs do not diminish thought or emotion. Paralytic drugs only block movement at the neuromuscular junction, so they only appear unconscious. And unless they are given drugs to sedate them, to put them to sleep and take away pain, they're going to be awake, alert, very aware, and very suffering. And so that's why I like to divide input, processing, and output. Because we as humans naturally assume that when we see somebody unresponsive, they're unconscious, and this is not always the case. So those of you going into anesthesia, you want to keep this close to your heart. Something I do, I talk to everyone as if they can hear me. Even if the professionals line up and say, this person cannot hear what you say, I still talk to them as if they can, because the human brain is far more complex than our ability to understand it. Well, many people seem profoundly retarded or unconscious because of their movement or speech, but maybe it's only an output problem. Maybe they have normal senses, normal emotions, normal thought, like this guy right here. He looks and talks like a profoundly retarded person, but he has amyotrophic lateral sclerosis, ALS. And he is Stephen Hawking. He is one of the world's premier physicists and mathematicians, very successful professor at Cambridge University, the Lucasian Chair of Mathematics, which is a position that Isaac Newton held, and he is also a best-selling author. So if you see a book by Stephen Hawking, see if you can get through it. He has amyotrophic lateral sclerosis, ALS. And ALS is a movement disorder. You might hear it called motor neuron disease. That's how they spell neuron in Europe. Or you might hear it called Lou Gehrig's disease. Lou Gehrig was a baseball player who developed ALS and died. Stephen Hawking developed ALS, and during the course of his disease, he came up with some astounding discoveries in the universe just because of the mathematics that goes on in between his ears. He is able to communicate because he has a computer that understands his hand and eye movements, and it makes talking sounds, and he's able to write using this special adaptive device that he can use to communicate.
My name is Stephen Hawking. I am a physicist.
He's married, and here's his daughter Lucy. He writes books with her as well. And so people with ALS are able to lead very productive lives. Something else you're going to talk about is Parkinson's disease. It's also a movement disorder, but it's a disease of the brain's basal ganglia. And because Parkinson's is degenerative, it eventually degenerates into a disorder of processing or thought, and that can result in dementia. That's usually later in the disease. Early in the disease, Parkinson's disease is a movement disorder. Huntington's disease is also a movement disorder that you'll talk about. It's also a disease of the brain's basal ganglia. It is a degenerative disease, meaning the neurons are degenerating over time, and because of this degenerative process, then this can involve disorders of thought and result in dementia as well. But again, that takes time. We consider Huntington's disease to be a disorder of movement. Well, Huntington's disease affects different neurons in the basal ganglia than Parkinson's does, and so you might read something that says Huntington's and Parkinson's are opposite diseases. In my world, Huntington's disease and Parkinson's disease are both diseases of basal ganglia, both extrapyramidal disorders, both very similar diseases, and they share many similar characteristics. All right, a few terms I don't want you to get confused. Central nervous system. Central nervous system refers to the nervous system inside of the skull, inside of the spinal column. So this means the brain and the spinal cord are central nervous system. And this also includes the eye and optic nerve. I read things that say the cranial nerves are part of the peripheral nervous system. Your ability to smell, cranial nerve 1, your eye and your optic nerve, those are part of your central nervous system. And then the nerves that run out of the skull, the nerves that run away from the spinal column onto the body, those are the peripheral nervous. That's the peripheral nervous system. That's outside of the skull and outside of the spinal column. And so the nerves of the body and the nerves of the head, cranial nerves 3 through 12, those are considered peripheral nervous system.